This chart shows certain characteristic radiological features of benign lesions of the liver like adenoma, focal nodular hyperplasia and angioma. If you keep these points in your view into your account, so hopefully you will be able to find these benign lesion quite easily. Related to CT scan and MRI, first of all, you should know which lesion is quite common in male and female. As far as adenoma is concerned, it's quite common in female as compared to male. Focal nodular hyperplasia is also very common in male as compared to female. As far as hemangioma is concerned, it is also very common in female compared to male. On the ultrasound or MRI, when you assess any lesion or tumor, first of all you must look for the capsule. There must be some capsule. As far as adenoma is concerned, it has its own well defined outer capsule, while in focal nodular hyperplasia there will be no capsule, and in hemangioma there will be no capsule. So far the capsular integrity is concerned, you can only see in the adenoma. Another particular radiological pattern is central scar. In adenoma, central scar is uncommon. Whether it is CT scan or MRI, there will be no central scar. In focal nodular hyperplasia, there will be scar because this lesion and this tumor is known for the central scar, and on T2 weighted images you can appreciate central scar, while in hemangioma there will be no central scarring. Calcification is a very important radiological pattern. If there is calcification, so you can confirm certain diagnosis. As far as adenoma is concerned, there will be no calcification in it. In focal nodular hyperplasia, there will be no calcification. Yes, in hemangioma there are calcification because this changes into calcified plaques, so you can appreciate certain calcification in the hemangioma, and especially when it is giant hemangioma. If you are doing any contrast enhanced CT, so enhancement can be seen uniformly arterial in adenoma, while uniform arterial enhancement can also be seen in focal nodular hyperplasia, and especially delayed scar will be enhanced in FNH. While in hemangioma there will be centripetal enhancement. Colloidal scintigraphy play an important role in the characterization of the masses, especially the liver common lesion. In adenoma, the colloid scintigraphy will show reduced uptake. In focal nodular hyperplasia, there will be normal uptake, but in hemangioma, the colloidal scintigraphy will show reduced uptake. Two quite common malignant lesions of the liver known as hepatocellular carcinoma and fibrolamellar carcinoma can be seen in male and female. Especially in hepatocellular carcinoma, the male predominance can be seen, while in fibrolamellar carcinoma both male and female can be affected. As far as the capsule of the lesion is concerned, in hepatocellular carcinoma you will find a thin capsule, and also in fibrolamellar carcinoma there will be thin capsule. In central scarring, in hepatocellular carcinoma, central scarring is very uncommon, while in fibrolamellar carcinoma you can appreciate central scarring, especially that would be low in T1 weighted images and on T2 weighted images. As far as calcification of hepatocellular carcinoma and fibrolamellar carcinoma is concerned, in hepatocellular carcinoma calcification is not very common. Up to 7% you can see calcification, but in fibrolamellar carcinoma there is 50% calcification can be seen. The contrast enhancement can be seen in hepatocellular carcinoma, especially arterial, and it may appear as a mosaic pattern, especially on portovenous washout, while in fibrolamellar carcinoma there will be uniform arterial enhancement and there is no scar enhancement on the contrast imaging, while you can appreciate this central scarring only on the MRI, and that would be low, and especially on the T1 weighted images and on T2 weighted images. But on contrast enhanced CT, there will be no scar enhancement in fibrolamellar carcinoma, while there will be contrast enhancement in the focal nodular hyperplasia, which is benign lesion. Colloid scintigraphy play a vital role in characterizing hepatocellular carcinoma and focal in fibrolamellar carcinoma. In hepatocellular carcinoma, there will be reduced uptake, and it would be less in well differentiated tumor, while in fibrolamellar carcinoma the colloidal or colloid scintigraphy will also shows reduced uptake.